Hello. I have a question for you. How hard is it to stay calm under pressure? My answer would probably be sometimes very hard, if I was being honest. And I think we could all say that. And who better to tackle this topic, stress, staying calm under pressure, than Dr. Leigh Vinocur, who is an emergency room physician, who highly regarded medical doctor who's been in the emergency room for years. So you can't even imagine the kind of stress. I sure can't imagine the kind of stress she's had to be under. And now she has a new book out called Never Let Them See You Sweat. So welcome, Dr. Vinocur. I'm so excited to have you here.
Thank you, Diane. I'm excited to be here.
Okay, so you have clearly, as an emergency room physician, been under all kinds of stress, all kinds of situations unimaginable to most of our even imaginations. How'd you translate that into never letting them see you sweat?
Well, actually, a lot of medicine is a little bit like that, this sort of stoicism that you have to be calm. You might not be that way in the inside. You might be screaming, sweating on the inside, but you don't want to come into an ER in dire straits and have your emergency physician, sweating. But the other part of it is, how science can help us manage stress and turn it into success. So that's the key part of this. And it's sort of the lessons that I learned along the way with some of the anecdotes that I had, but what's backed by science on how to manage stress. Because stress, not all stress is bad, and stress does need to be managed as a tool, especially chronic stress, because it leads to all kinds of medical problems.
So let's talk about training, since you mentioned training, and then the biology or the science of it. What can we train to overcome our biology to naturally have that adrenaline go from 0 to 60 super fast, and everything else that happens scientifically, hormonally, and biologically?
Right. So, stress is more than a feeling. You're right. It's a biologic response. And it's actually an evolutionary response that was developed to help us survive, right? If you're being chased by a predator, you need all these things to happen. It's the hypothalamic pituitary adrenal axis. So in the brain, the area, the amygdala, that detects fear. And then what happens is this cascade of sympathetic response comes out. So those things, like your pupils dilate, so you get more peripheral vision. If you're running from a predator, you start breathing faster, you get more blood and oxygen to your muscles. Your digestive system shuts down because you want to divert blood there. So those are all great for acute stresses. And really, but this chronic cortisol levels, catecholamines like adrenaline, chronic level is what's creating harm. And even today, we can't tell the difference, emails that are, filling our box with emergency situations versus running from a predator. So we haven't learned evolutionarily to distinguish that difference. But in certain situations, if you think about it, short bursts of that are good. I can tell you, if you're an Olympic swimmer or runner and you're in the blocks, you need that burst of adrenaline to go. And truthfully, as an ER doctor, when you're standing in the resuscitation room, waiting for the ambulance to come in with a multi-vehicle trauma or whatever, and your whole team's there, you need that burst of energy. But then when it's all over, you need to be able to let it go. And not maintain.
How do you do that? You just gave me goosebumps describing, there's been an accident, people are coming in. How do you channel that energy that you've got to be feeling, that stress? Because if you could take that from an emergency room and know how to transition it to a boardroom, and you could help people understand that, what an asset.
Well, that's entirely what the book is kind of about. And what I say in your personal life, and a lot of times in the emergency department or ER, right, you have this trauma code, then you're running to another code and another code, and your level is up there for the entire shift, okay? And it does take its toll. That's why I call emergency medicine a young person's sport, right? Because after a while, it can take its toll. But even when in the book, and I describe it too, that's important for all individuals to think about is to triage your stress, right? So triage is a system in the ER. Like, it's not a first come, first serve. Anyone that's been to the ER knows that, right? But that's good because if you have a minor laceration and someone's coming in with a heart attack, we want to take the most severe person back. You don't want to stand in line with the paper cut guy. So that's important. And triaging is the most important. Unfortunately, a lot of us in the ER have seen like mass casualties, right? And if you think about it, whatever colors you use or whatever you decide, there are some people that are seriously injured and no matter what you do, nothing's going to help them. Then there are some people that have such minor injuries that they're going to be fine no matter what you do. So what you need to do when you're, say, at a mass casualty is determine and tag who are the people that are sick but will survive or do better with intervention. And I tell people that's what they need to do with their stresses. The guy that cuts you off in the highway, I mean, what are you going to do? Chase him down the highway? And then in today's world, he's going to smash into you, have a gun. I mean, there are certain stresses that you have every day that aren't going to change your life. And you have to learn that it's not worth it. I talk in this book, and my hope in the book, it's actually geared more towards women. And I talk about my mom a lot in the book with my experiences because she wasn't a doctor at all, but when she was my best stress reliever. But when I would stress about something with her, she would say to me, really, Leigh, is this worth getting cancer or heart attack over? Because that's what sustained stress does. So she was already kind of teaching me, you need to triage it. And that's what you need to say to yourself. If it is something that you have control of, that is going to change your course in life or something important, then, that's what you have to tackle. But everything on either end, there are some things that might bother you a lot, but there's nothing you can do, right? Changes in elections and things like that, there's nothing you can do. So you have to, find that lane where this is going to affect your life. You have some control over it and then decide on what to do.
I probably recite the Serenity Prayer 100 times a day.
Right. It's exactly like that. So that's key. And then in the book, I also talk about, different kind of methods to do it. And there are a whole bunch of different methods to do it. But I think, even medicine, we talk about this idea of, sort of never let them see you sweat and how you handle things under pressure. But to really get that resilience, you need a system to support you too. And I think emergency medicine is changing that way. I wrote an article for Fast Company because burnout is an issue, right? In all forms of businesses, burnout is an issue, but it's particularly stressful in medicine today. So the key is, you need support from a system. And I think a lot of, as I said, when I talk about my mom, attributing it to, she was supportive. I mean, I didn't think now that she's passed away that I would be able to carry on, but I realized her support actually created that resilience in me. And that's why it is important that systems need to examine this too. It isn't just this stoicism where you think you're okay, because I do talk about in the book a lot, suicide is very high among physicians as a group. And it's this idea, there's issues with credentialing. There's this idea of admitting this vulnerability. Is that going to affect your hospital credentials? There is this underlying tone that if you have any mental health issues, you maybe are not fit to practice. And it's it's not fair. Physicians are humans too, right? They go through divorce, they go through grieving, they lose spouses, they lose children, and they should be not penalized in their line of work. I mean, we advocate for the mental health of our patients, and it's a little ironic that we can't advocate for our own mental health. So I discuss that in the book. And that's
you
part of
mentioned
it.
that's such an interesting point. You mentioned something a little bit ago. You said you primarily wrote this for women.
Yeah.
Why did you say that? Because is there a difference in how you think women or men are perceiving stress?
I think men can perceive it, but I think women have, truthfully, the biggest burden or load of stress, because it isn't just work. It's caregiving, it's home, and it's this perception. When I would go out and talk, women would come up to me afterwards and they're like, wow, how do you do it all? And I'm like, I don't do it all. I am a neurotic perfectionist. I have all the same insecurities that any other woman. And what happened is, and I've changed, pivoted in my career, different specialties, and then done other things with medicine in both business and startups and things like that. And I've, because I consider myself a lifelong learner and I love learning new things. And I saw so many incredible women that were stuck in situations, whether it was extreme, like I've seen in the ER domestic violence situations, which can be deadly, or very unhappy in marriages, or very unhappy in work. And they were afraid. They were afraid of failure. They were stuck. And I wanted to encourage them and say, everybody is feeling that way. You have to just allow yourself to do that. And I talk about some of the epic fails and things I've had. I've had, big failures too. So I wanted to give, I felt like my mother gave me the confidence to feel, whether I could or not, like I could do anything I put my mind to. And a lot of times I tried and I couldn't and I failed, but other times I did and I succeeded. And what I wanted to do with this book was provide that for so many incredible women that I've met all along the way, like yourself, for instance. So that's why it's sort of geared towards women. And I talk about a lot of things in the book, situations with me, breastfeeding and things like that, even my husband reading it, he goes, yeah, I could see where this is a little geared more towards women. But the overall lessons, I think anybody can take from stress, triaging your stress, things like that.
Biologically, do women and men respond differently?
Well, to the
stress?
the fight or flight response is essentially the same. And it does cause situations like in men, that constant stress can lead to low testosterone levels and all the issues with that. In women, it can lead to hormonal disruptions, and both of them, it can lead increased inflammation, can lead to diabetes, metabolic syndrome, gaining weight, heart disease. So in those respects, it's similar physiologically, but I think women internalize things differently, and I hope people, that not in a sexist way. I think we do. We are people pleasers sometimes more often than not. It takes a longer time in your life as a woman to realize, you get to an age where you're like, oh, screw it, whatever. But I think, early on we do that, and holding people together, even family health. If you look at statistics, who makes the health decision in the family? It's usually the woman. Men usually don't go to physicians until they're pestered if they're married and what. But I think the response and the internalization of it is a little different. So, and the fact that I really attribute all of the things I've done to the love and support, unconditional support that I got from my mother. And I wanted to be able to do that for other women. I'm a big believer in women lifting up other women.
Okay, well, then that gives me the perfect segue to say I'm sitting across from you and I'm looking at a very beautiful woman who looks like she's in really good shape. and does not look stressed at all. I mean, you do not look like you're carrying any stress. You look like you take care of yourself physically, and it looks like it's showing in your skin, and your eyes are vibrant. So
it's an effort.
It is an effort.
Right.
And what would be key things you would say to people that you apply to keep yourself in this kind of physical state of being?
Well, it's funny. I have a little chapter called All About Vanity, to tell you the truth. And, I say that vain is not a 4-letter word, and, when you talk to women and you're telling them that they need this because their triglycerides are too high or their cholesterol, it kind of glosses over. And I used to make a joke that I didn't believe in any medication unless it had a cosmetic result. Mm-hmm. But, vanity is sort of a little secret to keeping yourself healthy. And it's the vanity side effect is that maybe you are exercising more and your cholesterol levels are going down. So my feeling is, why not use something like that? I know it has these indications of frivolity and, women are supposed to not think about those things. But I always, in that chapter too, I say, look, you need to do for yourself what makes you feel good for you. Like, I don't do these things so that somebody else would say, oh, you look attractive. Oh, you look younger than your age. You need to do it for yourself. Okay. So it's not an objectification, truthfully. Because you're really doing it for yourself. And that's what I say. And it builds confidence. I mean, there is something, and I talk about a study about a bad hair day, right? When you feel like your hair.
Which is what I'm feeling like I'm having in this humidity.
No, it looks great, but I get it. Humidity is not your friend, is not our friend with hair. But it's true. When you think you look the best, you feel the best. And that's part of it. So those are sort of the motivating factors that I try and give to women too, that, don't do it for somebody else. Don't try and look like a celebrity, and don't do it for social media, which I think makes everybody feel bad now, because nobody's going to put themselves on social media when they're looking like crap, right? So, and I did blow my hair for you today. So, but a lot of days I don't. And when I came into the city, I was wearing a baseball cap. So, but yeah, it's doing these things for you is a big part of it. And I do talk a little bit about vanity and exercising, but all those things also can help reduce stress too. Exercise is excellent for reducing stress, and that's part of it. I swim sometimes, and when I'm in the water and I'm just listening to my breathing as I'm going back and forth, you can feel yourself relax. So there's a list of different things that you can do. But I really want to give women permission and some grace to give themselves a little space, right? Don't be so tough on yourself all the time, right?
Oh.
Right. That's the problem. We feel like everything has to be perfect. And
how'd you choose this title then? Never Let Them See You Sweat. Is this a tongue-in-cheek title?
Yeah, it's sort of like, how I functioned in the ER, but it's a point to say you can use science to reduce your stress, but you need to. I talk about all the ridiculous, funny, it's a lot of my experiences are, I make fun of myself a lot, and I don't take myself too seriously. And I use those as examples to show people and women that you can give yourself some space and grace. Things don't always work out perfectly, but to keep trying. Right. But to keep trying. And I talk about
stories is my theory.
Right. Right.
As you're proving, you're writing about them in your book.
Right. Exactly. I mean, I do recall one time, and there's this incident in the book, and I know perfectionism is a problem with me, problem with women. And my son had this project when he was, I don't know, maybe 10, and he was building this paper mache model of Mont Saint Michel in France, and it was on the thing, and it's on an island, and it actually looked pretty good, but then around the board, it was there. He painted just a little bit of blue because it was in the ocean, and I was like, "Well, don't you want the whole rest of the board to be blue?" And he's like, "No." I said, "Are you sure?" I said, "Because it would be perfect if the whole thing was blue." And he, at the age of 10, he was smarter than me. He said, "Mom, not everything's perfect in life." And it was driving me crazy that I actually painted it when he went to sleep. He was so mad. He did not talk to me for the weekend. Like I could not let it go. So the point is, I am very imperfect, and embracing your imperfections is sort of part of letting the stress go. So, and the point is, if you take care of your stress, they're not going to see you sweat. That was the point of the book.
You reminded me of a book. It was a fiction book, but I can't think of the title of it. It was something about a woman who was a high achiever under pressure. And there's a chapter in the book where the bake sale's the next day at school, and she realizes she's forgotten to bake something. So she runs to like the 7-Eleven and she gets a pie. And then she goes home and she's like banging the pie to make it look like it's home.
Right.
And it's flaking apart everywhere. But she takes it out of the thing, but she wants it to look like it was homemade.
Right.
And that was her moment when she realized, I have actually sunk to the point of torturing myself. That what difference does it make?
Exactly.
Other mothers might not have baked it either.
Right.
It's a bake sale, and what kid at the school is going to notice?
Exactly. So you have to give yourself permission. Although there's a lot of research to the fact that, mindfulness and being in the moment, cooking and baking is actually a great way to be in the moment and be mindful and stuff. So
or you might chop off a fingernail and feed somebody a little extra protein.
Yeah, you got to be careful about that too. So, so it's all part of it. And the title was, if science can help us harness stress for success, then they never will see you sweat.
So what's an example of how science can help us?
Well, I go through study after study. So, we talk about some stress relieving things. So obviously people know exercise is a good way to relieve stress. Then there's study after study about green spaces, right? There's Swedish studies that look at how much green space in an urban area should you have. It's very important for people living in urban areas to relax. In Japan, there's something called forest bathing, where you just go out in nature and you sit down. You don't have to exercise. You don't have to hike, although a lot of people that spend a lot of time in green space are also doing exercise. But even without exercising, just sitting in a park. And this Scandinavian study that was talking about it, they did virtual green spaces to see how people reacted. And they found that looking at sight, sounds, and smell, that actually smells were the strongest for stress reduction. So
that's so funny, because as soon as in New York when it rains, and I can smell dirt. Not grime.
Right.
Not grime, but that scent of dirt. I can feel my whole body relax. Right. So I always try to find some, even if I'm just walking past a little garden that's, all of 3 by 3 where they planted the one tree on the block.
Right.
I just like to stand next to that dirt.
Right. No, it's true. And because,
that's very funny.
While our sense of smell is not evolved the way animals have, it's still the more primal part of our CNS, central nervous system. And it's the amygdala, that area in the central nervous system that fires during fear and notifies you of threats. So that's a very primal reaction to it. So that was interesting. Blue spaces is another one, going to the ocean. I mean, who doesn't love the sound of the waves rolling in and you can just feel yourself relaxing, or sitting, people take vacations by water, lake, ocean, whatever. So those blue spaces are important. And actually, in the book, I also talk about the best investment I ever made when we finally renovated the master bath and I got this great soaking tub. And I would come home from a terrible shift or something in another job that I was working, multiple jobs, and I would just get in the tub and relax. And I know some people are like, oh, you're soaking in your own filth, but then take a shower first and then get in the tub, right?
I will always be grateful because my business was like at full maniac speed when I was pregnant with both of our children. And I would come home when I was pregnant with our first child. I would come home and we had this huge tub in our apartment. And my husband would have the candles lit around the tub, and the tub would be at a very warm temperature. And he'd be like, the tub's ready. Get in the tub.
No, it's so true. I love it. I mean, I don't even need the candles. I don't need the wine. I just get in, and sometimes I put my head completely under the water, and I can just hear my heart beating, and you can just feel your stress go. So those are ways, also talking about, mindfulness, whether it's baking or flower arranging, making something beautiful that you like. I love doing that, getting bouquets at home and then rearranging them however I like. And, people talk about art. Art therapy is very relaxing. And there's a lot of studies that show that it's useful. But people are like, well, I'm so not talented. I can't paint. Guess what? There's coloring books for adults just for that reason. All you have to do is color in the lines or out of the lines, whatever you prefer. So there's coloring books. There's adult Legos. I've put together these little flower arrangements out of adult Legos that were just fun to do. And while you're doing it, you can just feel yourself relaxing. You're concentrating on something else, So there's, all through the book, there's a host of different things that you can do. And then I do discuss,
I have to say, so far, all of those are very refreshing things that, I literally own about 3,000 books. And I'd say 1,000 of them are all health-oriented in one way or another. I have never read a book that addressed the things collectively like you're put together, which is very interesting.
Thank you. Legos weren't mentioned in the book.
All these things.
Sponsor me, Lego.
That would be a good one.
Yeah. But in any event, no, all of those things. And as I said, I poured over the research, what did the studies say about it? I didn't want this to just be, here's my experience. This is what I say because I'm a doctor. Because also I'm one of those doctors that believes their patient, I have to say, all my doctors.
Well, that's very wonderful to hear.
Yes.
That's an exceptionally high quality that I'm sure puts you at the very top of your profession.
Well,
because so many people don't feel heard.
Right. No, it's
true.
And
I think so much of healing in whatever it is that needs to be healed starts with feeling heard.
Oh, I totally agree. And that's why in the book I say, you really want to reduce your stress and be heard, get a woman doctor. Because study after study shows women surgeons less infectious complications after surgery, less readmissions to the hospital after their discharge. Women tend to
I got to
listen.
give I just happen to have had a lot of male doctors. The only 2 doctors that ever fired me were women.
Really?
Yeah.
I'm surprised at
one
that.
because they thought I wasn't taking my moles seriously enough, that I missed a 6-month appointment. And another, when I was questioning, because I gave birth at 40 for the first time. And she thought I was asking too many questions. Whereas my male doctors, I have to say, all the time in the world to talk about whatever.
Really? Well,
so the science might be off, but maybe I got lucky.
Maybe you did, because the science is there, that there are less complications, less readmission rates.
Do you think that's, wait a second, because I'm a science person. I've worked with clinical trials for 30 years. Do you think that's because there's not enough data current
women.
data for female doctors versus male doctors?
No, I really don't believe it, because some of them were meta-analysis, as you know, where they looked at all the different research studies. There's been studies that show women physicians follow clinical guidelines more. In fact, related to heart disease in women, for the longest time, as you know, I'm sure, women themselves weren't taking their heart disease seriously, and doctors weren't either. There was this idea that, estrogen is so protective, a woman coming in, and then they don't have the crushing chest pain. And there had been several studies that a lot of women came in, there were delayed diagnosis with their heart disease, and that they were not put on the same protocols as men. And there are studies that show that women physicians, and by the way, when I went to medical school, it was probably 30% of the class were women. Now it's a little bit more than 50. There's still that glass ceiling. If you look at who's running the healthcare systems, you look at who's the head of academic offices, it's still only about 10% women. But it more likely to put them on the prescribed protocols, follow the guidelines and things like that. So the research, I think, bears it out. And in my experience, I usually end up going over in appointments, and we're laughing and talking and with the women doctors that
a lot of the research part, though, I've probably been involved in what?
The studies are in the book.
No, it's interesting, the studies you're referencing, because I think a lot of doctors are getting their information one way or another from pharmaceutical companies. And most pharmaceutical research, having done that for almost 30 years, is based on men.
Right.
Very few, you've got the nurses study, but other than that, there have been very few that are focused on women, which makes me say, drugs that are titrated, they're titrated to the average 180 to 200 pound man.
Right.
So
so that's with drug discovery and drug, but this is with outcome studies, looking at men and women physicians. And look, there's great male doctors, right? I'm not saying that, but I think, in certain respects, in my experience, and certain research with outcome studies have borne this out, that women tend to listen. I've never heard of firing a patient just because they missed an appointment. I don't know about that, but that's not acceptable. And I'm sure there's bad apples on both sides.
I was pretty shocked when I got the letter.
Yeah.
In fact, I said I should frame this and send it to some newspaper.
That's, and actually, I don't even know how you do that. There's all kinds of abandonment issues and things that can be charged. But anyway, but for the majorities, a lot of the outcome studies bear that in mind. So
very interesting. What science do you think is misleading? Do you think there's any things you've seen in recent years that you'd say to people, well, think twice about that? Or where are you getting your science from? Or check multiple sources. What do you...
Yeah, well, and I do also...
Because that's a big internet thing.
Yeah.
It's the rise of the Google doctor.
Right.
Which I'm sure you've seen plenty of,
yes,
which is a
and
plus and a minus.
Yeah, I've also talked with people, you have to make sure that the sources are reputable. And even using AI, there are mistakes, as we know. Sometimes complete made-up references are made up. So, I always tell anyone, if they're trying to use AI and they need to reference something, you better look up the reference that AI has given you, because it might be made up. They talk about phantom studies and phantom references. But, I think in general, I love patients to come in informed with a handful of Google documents to discuss, because those are people that are invested in their health, right? And they want to do that. But I also do know, medicine is not perfect, right?
That's the practice of medicine.
Yes, it is not a perfect science, and or nor a hard science, right? So the point of it is there are fads in medicine too, and a lot of things are sometimes not right. When I talk about menopause in this, I talk about how, the history of it a little bit, in the 50s and 60s. And when there were more male doctors and women would complain of this, I think historically there's a lot less listening with male doctors, even historically, right? Mother's Little Helper, giving them Valium, and then everyone was put on Premarin, right? And then they started to do the women's health study, and then they interpreted it this way, and then everyone was taken off of hormones. And so, you have to make individual decisions, and you have to have a doctor that you trust, that you can talk to, that you can weigh the options with, okay? And medicine's constantly evolving too, so you have to sort of keep up with it. So I think hormonal therapy in women, first everyone was on it, then it was maligned. Now this idea that, maybe you should be on it, maybe short term, I discuss that, you discuss with your doctor, but then, it depends. If you have a very big family history with breast cancer and other cancers, you have to do what you're comfortable with too, even though maybe the research doesn't always bear everything out. You have to feel that you're comfortable, because if you're constantly stressed and worried that you're going to get cancer, you better be careful, because because we know stress can contribute to immune dysfunction, and that creates problems with our body surveying cancer cells. It can worsen cancer diagnosis and response to therapy. So it's critical to sort of get your stress in control.
So you've got the mind and body connection.
Oh, yeah.
And what do you have to say about that?
To ever think that they were separate was ridiculous, okay?
Good start. That pretty much says it all.
Right. I mean, it's, and all these, if you think about all these funny sayings, go with your gut. Well, guess what? Your gut has more serotonin receptors than your brain, right? So that's where it came with, go with your gut, right? So yeah, absolutely. And we're finding out now there's just so much connection more. I mean, we didn't understand the chemistry, the psychopharmacology at one point, but now we're starting to understand it more. So definitely mind-body connection. I mean, that's sort of what the book is. You can, I tell people breathing exercises, right? They talk about a quick way to reduce stress. Every watch now has an app for mindfulness where, you take some time to breathe. But that kind of box breathing in for 4 seconds, hold it for 4 seconds, out for 4 seconds, stop. I mean, that can sort of rewire your brain. So yes.
It's funny you mentioned, the watches.
Yeah.
And I was with a group of people this weekend for about 3 days, and we were having different conversations, and I found somebody's watch sitting by a pool, and I'm like, wait a second, what is this thing? It's not like a normal watch. And they were like, well, if I take my pulse, I track how my sleeping is. And I'm like, whoa, that's a lot of information. Do you really want it? Well, I get some days it really stresses me. I'm like, do you really want this information? So you had a bad night's sleep, it wrecked your morning?
There's, too much, a little bit of knowledge can be a dangerous.
Yeah.
No, I totally agree with that, too, even as a perfectionist. I started to look at my watch for sleeping, right? And, I read all these studies. Okay, deep sleep should be 10% of your sleep, and it helps prevent dementia, So every time, not to mention I hate to sleep with anything on me, but I decided, okay, I'm going to set up the sleep and sleep. Okay, if it's 9%, I'm like, oh my God, I'm going to be drooling in a corner, and, in 2 years, I'm going to have total dementia. I realized this was stressing me out, trying to figure out, like, I had a bad night's sleep. I didn't. So yeah, I'm not checking my sleep that often in the watch.
It's so funny because that's what people were like, oh, I can't believe you, of all people, I would have thought you would, be wearing this. You would be tracking this. My brother, who I've done health experiments with for 30 years, he's like, I can't believe you don't want to wear that. I'm like, I have done extremes of everything. I lead a moderate life at this stage of life. And to me, you have to get to the point where you have to be comfortable
Right.
with what am I going to change at this point?
Right. No,
What am I going to change that, if I notice those differences? I can't really think of anything that.
Right. And the whole thing is like, how do you make yourself sleep deeper?
Deeper.
I mean, you can't, right. But I do have to say, after doing extensive research, when I realized I was getting less than 10 to 12% deep sleep, I found out that, nothing's perfect. And a lot of times the watch misinterprets REM sleep to deep sleep or core sleep to deep sleep. So that made me feel a little better at the time. But yeah, no, I agree. Once in a while, it's interesting if you do it. And I also noticed the nights that I got less sleep, I had the higher percentage of deep sleep. The nights that I got more sleep, I had a lower percentage. So I figured my body's got it figured out.
One of the things you're seeing a lot of, and for years I've always used a body fat scale versus a traditional scale. And you hear all these people that I think are further stressing themselves in very odd ways about longevity.
Oh.
That everyone's going to live to forever now. We're in a society that no one's going to die. No one wants to acknowledge death as part of life.
Uh-huh.
I'm a big proponent of talking more about death. I think it's important because it helps you live.
I agree.
But what do you think about all this new, how we're all going to live forever and beat the Grim Reaper?
Well, I think that it really depends on the population you're talking about, because 75% of America is either obese or overweight. And those people are not going to live forever. But there's a big push for longevity. Obviously, lots of famous authors and scientists and physicians that sort of talk about it. I think it's nice and aspirational, right? I mean, I talk to patients when they're really sick and have diabetes, type 2 and all this. It's like, think about you mortality isn't as important as morbidity. Do you want to spend your years in doctor's offices? So you have to think of getting your health for that, as opposed to doing it to try and live forever, And
that's an excellent point.
Right. So it isn't
mortality and morbidity all in one sentence. It's a really good perspective to think about.
Right. So you don't want sickness. That's what you don't want. Right. And then, but I find it fascinating, these super agers, these blue zones, I read about it, you try and whatever. I mean, I think for myself, I want to see my son settled, married, kids, happy, and then I'm okay. I had him later in life, so, I'm an older mom. My mom had me very young. I remember at one point when I finally got pregnant, she goes, "It's a good thing I had you at 19. I'd never met my grandson," who she adored. So I feel bad. And also, my family history is not one of longevity or super agers, except for my mother's father. He lived to 95, but everyone else went pretty quickly. So for me, I just want to stay healthy as long as I can, see my kids settled, and then I'll worry about the rest.
Since people always talk about diet versus exercise, but let's add stress and relaxation into it. If you were going to, in your medical hat on, as someone who's done a lot of research, if you were going to say, what do you think is the most important, or how would you prioritize what people are eating, how they're exercising, and how they're managing their stress?
I would say stress number one, truthfully, not just because of the book. But stress also has us create bad behaviors too. We eat when we're stressed out. We drink alcohol when we're stressed out. We smoke, right? So stress, I would put at the top of it, and managing that stress. And then, going from there with trying to eat healthy, and I even tell people, go for the 85-15 even,
Mhm.
right? I mean, like I said, you can't be perfect, right?
Mhm.
I've seen so many women like they're doing great and then they blow one day or they eat something that they shouldn't have. And then they're like, oh, I blew the day. So then they eat 10 times more things.
Mhm.
Don't do that, right?
Mhm.
If you think 85% of the time you're eating pretty healthy, of course, if you go to a great restaurant and they are known for, I don't know, some fabulous dessert, why wouldn't you try it?
Mhm.
So those kind of things. And diet, I would probably even put exercise a little above diet. But truthfully, your diet is more important for your weight control. I mean, you'd have to exercise at the level of an elite athlete to
Mhm.
really, get lean, but they sort of go together. But I think stress is at the top and kind of trying to manage your stress because it's a cascade effect. I mean, people that get type 2 diabetes, it's due to inflammation. Stress causes inflammation. They get
Mhm.
resistant to insulin. And then, it's just kind of down the hill from there, heart disease and everything else.
It's funny. You mentioned your mother a lot. My mother was one of those people we all thought was going to outlive everyone because right up until she died at 92 was
That's
basically
pretty
running
good.
circles around
Yeah.
everyone. And, she was an early adopter of reading The Power of Now.
Yeah.
And, always, into, but very religious but exercised, always moving, always moving, always moving. Ate ice cream every single day.
Yeah. No, right.
So when we would get together as kids and say, well, it really doesn't make any difference what she eats. Just make sure you have some ice cream every day.
Right.
Because that's probably why she was less stressed. That's probably
Right.
why she could handle the 5 of us. She had that ice cream every
Right.
day.
Yeah. No, I think that's great. And I agree. I mean, I had, I talk in the book too, at the time, she was sort of like my son's adopted grandmother. She lived till 98. I helped take care of her. At the very, very end, she had dementia
Mhm.
and such. But she, I think maybe it was her 95th birthday. She had a friend come over that was like 98. Just just this beautiful little lady. She was in her Chanel suit and she was still wearing heels. And I remember my husband, our step didn't have a rail when he came in the door because I gave her a party at our house. And he said, may I help you up? Oh, no, I'm fine. She did it. And then they told me the story when she finally died. Her name was Leigh, too. And I thought, wow, that's a great way to go. She was 98. She always looked great. That morning where she lived in assisted living, not a nursing home, she went down. She had her hair done. She met her girlfriends for lunch at the place. She went back up to take a nap and she never woke up. And I
That's
thought,
the way to
that's
go.
the way to go, right? With your hair done, looking good when they find you. So
Exactly.
a good hair day.
A good day all around.
Yeah, exactly. So yeah, no, it's true. And even Flo, my beloved Flo, it wasn't really until the very end that she got dementia.
Mhm.
So she did great on her own. But I also talk about she was never married and never had kids. That'll help your telomeres. I once remember somebody saying to me there's a little research on either side. Telomeres are the end caps for the DNA, right? And they keep you. So one said you're having children lengthens your telomeres, and one said it shortens them. And I'm like, telomeres, teleschmears. I'm telling you, having kids shortens your lifespan, whether your telomeres look good or not. I mean, it really can get to you. And she never had a husband, never had children. So.
Is there actually scientific research that says?
Well, you know what? There is research that if you're in a bad marriage, it's very bad for you. And if you're in a good marriage, it's good for you. So there is research that looks at that. And especially for men too. Yeah. So there's a little bit of research to that. And it's all because of stress, right?
Yeah.
Bad marriage, stress. Yeah.
Yeah, I certainly think marriage has its cycles, but it's funny. I had, like I said, I had our daughter at 40 and our son at 43, and the doctor I ultimately settled in on, it was like, wait a second, I can't believe you had the first one naturally and you're having this one natural. I'm like, yeah, and when I
Very cool.
ended up doing all kinds of hormone testing after at one point to do some different life insurance policies, everyone was like, oh my God, you've got this blood work like a child.
Good.
And they said a lot of it had to do with having children. So I think there is an argument that, I don't know it scientifically, but actually that having children, as aggravating as hell as they can all be at certain times,
Yes,
could actually extend your life.
Yeah. Well,
Because you want to see them get married.
Right.
You want to see them have children.
Yourself to have children, right?
Yeah, and you want to see them have their own apartment so you can see those videos they have online where you're going to spill the water and not clean it up, and you're going to dump the cereal,
right,
leave it on the ground and
leave
crunch
the
all over it.
refrigerator open. Yeah, no, it's true. You want that chance to get back at them. So, no, I do. I think it's true. And actually, to use a medical term of fecundity, meaning being fertile and stuff, you actually, if you had your kids at that age, I'm sure that you probably did have a pretty interesting blood work to have them naturally at that age. Yeah. So that's pretty nice.
Well, I wish we could keep talking, but our time is up, unfortunately. I have been talking with Dr. Leigh Vinocur, excuse me. And she is the author of a really cool book that's just coming out called Never Let Them See You Sweat. She's been an emergency room physician. You're in private practice now, I gather, as well?
Yeah, I'm a medical director of a men's health clinic. And
so she has really seen it all and knows all about those really stressful situations. So she has shared, you shared some really amazing advice that you have in this book. So I can't wait to go out and buy my next copy. And I'm sure I'll be sharing it with lots of others.
Well, thank you. I really appreciate it. And this has been fun too.
Yeah.
You should go for coffee.
Absolutely. You are a wealth of knowledge. Really a pleasure. Thank you.
Too.
Thank you very much. I'm Dian Griesel. This has been the Silver Expedience Perception Dynamics Podcast. We are in the really cool Manhattan Center here in New York City on West 34th Street. We're in right now. TV2. A lot of things have happened in this place. So it's always fun to be here. So big shout out to Manhattan Center. Thank you very much for tuning in. Please hit subscribe. You're going to find all kinds of info about Dr. Vinocur below in the comments section here. So please stay in touch with her. Thanks a lot, everybody. Subscribe.